welcome back to Seriously, Where's the Good? Episode 6?
I think we're at 6, yeah.
6. We're good. I'm gonna quiet it down though. Happy New Year! And sorry we didn't have an episode last week because we were celebrating holidays.
It's been 2 weeks?
No, just 1 week. We just didn't post anything last week.
Oh, I thought it was 2 weeks. I'm behind, I guess.
No, just 1 week that we didn't post.
Anyway, thanks. Yeah, we were just having a whole bunch of other stuff going on, so.
Holidays.
I think we're good.
Okay. So this episode we're going to talk about the ectopic pregnancy.
Yeah, last time we went over the beginning of, or not the beginning, but the end of
C-section
and the recovery and stuff like that. So, after the recovery, jump, 2 years?
No, Neymar was about 15, 16 months, I think.
Was he?
Yeah, he was.
It's a year and a half almost.
Yeah, he was about a year and a half. And we weren't trying to get pregnant, but we got pregnant. No, we weren't trying, but it wasn't
We weren't trying not to either.
Yeah. So we knew it was a possibility that we could get pregnant around those. But anyway, one thing that I remember when we posted this video was that people were upset at the fact that when I showed you the pregnancy test, I was like, I was so scared you're gonna be so mad at me. And that was more of my fear of I don't know, I'm scared of a lot of things. I'm just scared. It's not really necessarily that Branson was actually going to be mad. He was in it too. He knew what could happen. It takes two to tango. So it was more I didn't think he was going to be mad at me. I just thought it was going to be more of this wasn't planned. It's not like he was going to be mad at me or anything like that. Just
because there was a lot going on at the time. We
Yeah.
weren't trying not to, but we weren't our what's the word? Our time frame was further down the line
yeah.
for wanting to get pregnant. So we had stuff going on before that point. They were trying to get done before we got pregnant again.
Yeah, so anyway, I wasn't actually scared that he was going to get mad at me. I just felt like I needed to clarify this for all of those who thought that I was scared. I was actually terrified that he would be mad at or upset at me. I don't know, how to explain it any better than that. It wasn't that. I don't know how to explain it. Do you know how to explain it better? Me and my anxieties?
You're just scared of everything.
I just
anything that can be scared of, she's scared of it.
I have a lot of anxiety, and I don't mean that to use as an excuse or stuff like that. I just literally am but I know I own it. I am very fearful of things. Anyway,
we talked about differences last, the opposites, right? Opposites
Yeah.
attract. I don't really she says she has these not panic attacks but anxiety attacks or whatever.
Mm-hmm.
Feeling anxiety. I'm I can't, I don't really get anxiety.
Yeah, he doesn't. It's really weird.
Yeah, I don't get it.
I'm overwhelmed under pressure, and I start to panic, and then I don't do anything because I have so much to do. And he's like, make a list and then get it done one by one. I'm like, it sounds so easy.
Yeah, so in my
but
head
it's so hard.
I'm good at prioritizing things in my head. if I
I'm horrible
going
at
based
that.
off of that priority, that's a different story. But like prioritizing over the other things, so I'm like, okay, this needs to be done, this needs to be done, this needs to be done. Of all these other things that need to be done, but they don't need to be done right now, so I don't really care about them. These things I need to get done, so I'm gonna work on these ones, right?
Yeah.
And but even then, like, I don't really get. Even when like we've had tight months or stuff like that, it's not like anxious. It's just like, what do I need to do next? Like what do I need to do to get out of this? Or
Anyway,
and yeah, so it's
all that to say, like, it was me and my anxiety, not necessarily him actually getting mad, if that makes any sense. Like, it was just not planned. So I guess I was really anxious because it wasn't planned.
yeah,
So I show you, you're like, oh my gosh, like, we're pregnant. Wow. There was no anger whatsoever. And I was like, oh.
the other thing is like people also like, oh, he has no emotion, like he doesn't like get excited, and because of the things we've gone through, it's hard for me to get excited until a certain point. Like the first pregnancy test is cool,
Just a step further.
but it's there's so many things that need to happen before it sticks, right? Before it's actually, and there's more to this story that kind of adds to that. So like I am excited, but I also am trying not to get too deep into it because
And I was the same way. Like,
yeah,
I was excited because it's like, oh my gosh, like, this is unexpected. We tried so hard for Neymar, and this one was not planned. I didn't think we would ever have that situation happen.
yeah,
So that's why I had like a little bit of hope, because I was like, whoa, we weren't trying for this, and it happened. So I had a little bit of hope, but I was still so scared, so I kept taking tests and comparing them to Neymar's tests. I took pictures of Neymar, so I had pictures of like the progression line from Neymar's pregnancy, but I also kept them all in a baggie. just in case I ever like needed it. If I didn't have the
yeah.
pictures.
Her luckily we have like separate vanities in our bathroom. Like my vanity, I have all my, shower
They're in a
whatever
bag. They're not out in a like they're in a bag.
right now. There was a time that they were just lined up on the.
Okay. But that was
I
when
don't
I
know.
was
I don't know
taking
if like
them regular. I mean, like,
yeah.
now they're like closed bag.
Now, yes. But I'm just talking about like. But then don't you have a jar?
I have a jar.
So there's just pea sticks everywhere on her side.
Hey,
I'm not saying it's a bad
I don't
thing.
think
It's
I
just
kept Avalyn's. I don't think I have hers. Or maybe I did. I don't remember. Anyway.
you probably do.
I just say anyway all the time. So I was testing and comparing the days, like days past ovulation, and like the darkness, is that the word? Of the lines.
Yeah, how dark they were getting.
And this pregnancy was less dark than Neymar's pregnancy. And Neymar's pregnancy was like exactly every 2 days it doubled all throughout. This one, it was like 3 days the same. Then 3 days it was getting darker, but very, very slowly. And it was already way lighter than Neymar's on that day. And then it dipped for one of the days. There was like it got lower. And when I mean it dipped, I don't mean like I took one test and it was lower than the day before. No, I took tests throughout the entire day to make sure that like my pee wasn't diluted or all that. Like, I'm an expert at taking pregnancy tests, guys.
Like I said, it was lined up. We had lines of it.
So
of pregnancy tests.
So I took many tests that day, and they were all lighter than the day before. And then I started spotting that same day. And I was like, oh, okay. I'm miscarrying. Like, it's the same thing. that
Yeah.
happened with the other two. It's going lighter, and now I'm bleeding. And I think it was around the 5 weeks pregnant, so it lined up pretty much the same
Yeah.
as the second.
Like the same timeline.
Yeah, as a second miscarriage, not the first one. The first one was a little further. But anyway, so I was like, whatever. So I called the nurse at the OBGYN that I go see, and I said, hey, I'm miscarrying again, and this would be my third miscarriage, and I feel like that's not normal. Can you, can I like set up an appointment with an OBGYN so that they could test my, like, you know, get like my hormones tested to see if maybe my hormones are off and that's why I'm miscarrying so much, or so we can find
What the issue is.
Yeah, and she's like, actually just come in so we can get your HCG levels checked to make sure that you are miscarrying, because spotting isn't necessarily you miscarrying, and you shouldn't trust the pregnancy tests very much. So I was like, okay.
And if you've ever been to an OBGYN, like the first time, you know, you're going through the motions or whatever. The second time, they treat it like your first pregnancy. Like it's interesting. Like that you've never been through it or anything like that. Like it's your first pregnancy again. It's like, no, we've been through this.
We kind of know a little bit more than before. So, but I was like, okay, I will like give her the benefit of the doubt. Like I've heard some women spot during their pregnancies, and I was just spotting at that time. So we go in, I think it was the next day or 2 days later, probably the next day, to get the first. You go in one time and then 2 days after you go again, so that they have like comparison. It should be doubling. So that day, I started bleeding, like full on bleeding. So I was like, okay, well, it's obviously a miscarriage, but we're gonna go anyway, so that they would have it on their like file that I had another miscarriage, and then that would maybe actually have them take us more seriously about our situation.
Yeah, because they didn't really like. We told them about the first two chemical pregnancies, and they don't really care that much.
Yeah.
And so we're like, okay, this is the third one. Let's see if they'll actually take us, you know, like Mara said, take us seriously. We're actually.
Yeah, and the first two, it was just me telling them. We didn't actually get our blood work checked or anything like that. So we went in, they did my blood work, but in my head, because I was bleeding, it was a miscarriage. So I told Branson we were going to wait to tell everybody that we were pregnant, as like we were going to wait for like as much as we possibly could to tell everybody, right? For that pregnancy.
So. Yeah.
But I was like, you know what? We're miscarrying, and I don't know if I can do this again alone. So I was like, I need the support from your parents, from my parents. Let's just
let them know.
Let's just tell them that we're currently
going through
another miscarriage. Mm-hmm. And so we did, and we didn't go in when we were supposed to on the second day, because I was like, it's over, we're done. So the next day after that, we got a call from the nurse saying, hey, you didn't come in. Can you please come in to get the next blood work or the next HCG level checked? And I was like, oh, I'm like full on bleeding now. I really don't think I'm pregnant. She's like, just come in anyway, just so we can have it. I was like, okay. We go in, the next day, we get a call, and they say, your HCG levels are rising the way they should. And I was like, what? I am full on bleeding. The tests are like, yes, they're getting darker, but like barely. And they're very like on and off. Like,
yeah,
it's not consistent whatsoever. And I knew that wasn't the same as the early miscarriages. So I was like full on like Googling and searching on YouTube. Anybody had like symptoms like that, and then ectopic pregnancies showed up. And so I was looking at all the ectopic pregnancy stories that I could find, and everything that they were saying was what I was experiencing. And so I remember I was texting my mom. I sent her the pictures of like the line progression. And I was like, does this look like an ectopic pregnancy? And she's like, trying to be hopeful, right? Because obviously she didn't want to like...
say it was.
First of all, like scare me more than I already was, but also like she also wanted to be hopeful and not wish that on me because, you know, that's scary.
Yeah. Should probably explain what an ectopic pregnancy is.
Oh, it's when the embryo, is it an embryo at that point?
Yeah, I think so.
It implants in a fallopian tube instead of in the uterus. So the uterus has 2 fallopian tubes that go up to the ovaries, and it just implants in the tube rather than going all the way into the uterus or anywhere else in your body. Where it's supposed to go in the uterus.
If it goes anywhere else,
it's ectopic. But this was a tubal ectopic pregnancy. And where was I? Texting my mom.
Yeah.
So she's like, no, I don't think that's, like, let's not think that, you know? Let's just keep waiting it out. But in my head, I was like, oh no. Because I'm always like, worst case scenario. This is
the worst case scenario.
This is a worst case scenario. I have to be on the lookout. Like, I need to make sure that if I feel any sort of pain, we need to get checked out.
Because if it is like in the tube, it could be deadly. Like, it could get to the point where
your tube can rupture and you bleed a lot because a lot of blood goes to the uterus. And
so there have been women that have died from it, and so like it is something to take seriously.
And we had already been through so much struggle getting pregnant. I did not want to lose my tube. So I was like, if it is an ectopic pregnancy, I need to get in there as fast as possible and let them know that it's that, so that I could get the medicine to end the pregnancy, which sucks. Anything would suck at that point. Ending it by taking medicine or going through the surgery because you need surgery. It's just like you're ending your pregnancy.
Yeah. So either way, it's like
either you do it or the doctors do it. Like, it's just... Anyway, so I really didn't want to lose my tube, so I was really like tuning in with my body and like making sure that if I felt any pain, like I would go in immediately. Because the doctors and nurses were saying, you're fine, it's just, it's normal, like, this is normal.
Mm-hmm.
So Thanksgiving, we went to my parents, and for like 4 days?
Yeah, something like that.
I don't remember if it was the first day or the second day we were there. We were driving someplace that night. I think we were going to the store. And I felt a really sharp pain on my right side. And I was like, there's no way.
Yeah.
There's no way this is happening. Like, it's not. But we have, like, I told Brent, I'm really hurting on my right side and it's like sharp pain. But I was like, maybe I'm exaggerating the pain. Maybe it's not actually there. Maybe it's all in my head because I think it's an ectopic pregnancy. So I called my parents and I couldn't move. It hurt so bad.
Yeah, it was rough.
But I still thought it was in my head. So everybody's like, yeah, go to the ER. We told your parents, hey, we're going to go to the ER. Mara's having pain. So we go in. We're talking to the nurses that are in the ER, and they're asking me all these questions, like, how far along am I? Like, all the things. So I let them know. I think we were about 7 weeks at that point.
Yeah. And
so I was really scared because anywhere from 6 weeks to 8 weeks is like where a lot of women have like their tubes rupture.
Rupture, yeah.
So at that point I was like, if it is, like I'm getting close to my tube rupturing. But because I'm hurting, like it either already ruptured or they're going to do an ultrasound and they're going to see it there. But we go in, they want to do an ultrasound, so they do an ultrasound, and the tech can't say anything, right? So she's just like trying to talk to us and like trying to not be like negative or anything. And we wait for the doctor to come in, and I think we heard her talking to somebody on the phone explaining my situation.
Mm-hmm.
They had also already told us my HCG levels, which were not where they were supposed to be. I think I was supposed to be in like the 1,000, and I was only like 700. And so yeah, we hear her talking about it, and I'm like, this is totally an ectopic pregnancy. Why won't they just
Do something about it.
say anything? She comes in, she says, we think you aren't as far along as you think you are. I'm like, I've been testing.
I don't talk about people very often, but this lady was, one, she was young, and two, she shouldn't be anywhere near a hospital. Like,
Not only that, but the male nurses in there, I was saying, yeah, I've already had 2 chemical pregnancies, or an early miscarriage and a chemical pregnancy, and they're like, what's a chemical pregnancy? I was
they
like,
didn't know any of the terminology, like anything like
you
that.
don't know
I'm
what a
like,
chemical pregnancy is? I was like, what is happening?
yeah, it was, yeah.
So anyway,
So if you recognize this from the ER, you should quit your job. I'm sorry, but you should quit your job and go to a different field because you are a terrible doctor.
I'm like, there's no way I am not as far along as I think I am, because I tested days before my period was supposed to start. Like, and it was positive days before. So there's no way that I'm not as far along as I think I am. But they wouldn't believe me because, first of all, they don't want to end a pregnancy that doesn't have to be ended. So they have to be for sure that it's ectopic. And the reason why they couldn't do that was because when they looked at the ultrasound, they didn't see anything. They didn't see anything in my uterus, and they didn't see anything wrong with my tubes. So they're like, I think you're just not as far along as you think you are.
Yeah.
There was
a reason why, right? They couldn't see it. Like they didn't.
No, they just thought I was a week behind. So I was around 5 weeks-ish, which still doesn't make sense, because if I was at 5 weeks, you would still be able to see a sac or something.
Yeah, they just didn't see anything.
Like, so I was.
They couldn't get a. That's what they couldn't get a clear shot of the tubes, but they didn't see anything in the uterus. So they're like, oh, it's probably just not as far along as you think.
They did say it could be an ectopic pregnancy, but I think you're just not as far along as. I'm like, I think it is an ectopic pregnancy. I think you should take me more seriously. They're like, wait a week, come back. Was it a week or a few days? No, come back in a few days to get more blood work done to look at your ACG levels, so that they would see if they are rising how they're supposed to. Mm-hmm. So I was like, okay, whatever. I can wait 2 more days. I go back. I call him. They're like, that doctor isn't. She's on vacation. I'm like, you're kidding. So like, where do I go? They're like, there's no doctors here, but you can go to another. So I asked my cousin, because she was working in that like medical field from like a different, like a clinic type thing. And I'm like, hey, listen, this is happening to me right now. Like, do you think you could sign me up to go see one of the doctors in your office so they could test my HCG levels? And she's like, yeah, come in tomorrow and we'll get it done. I was like, okay, thank goodness I have family members that work in this area. So
Which, by the way, she hasn't said it, but she's been paying this entire time.
Yes.
The pain hasn't gone away.
I'm bleeding and I'm in pain.
So it's she can barely walk.
Oh, and the day after we went to the ER, we had Friendsgiving.
Is that what it was?
Mm-hmm. So we went to Friendsgiving, and I had to act like I wasn't in pain.
Because we'd only told like our parents. We hadn't told anybody else. I
No.
don't think.
And I didn't feel like that's something we should talk about during a time that we're wanting to be happy and like thankful for things and all that. So I was
Yeah.
like, this is not the right time. But yeah, it was hard, like, not. It's always hard pretending like you're happy when you're not like fully happy, or pretending you're not in pain when you're in pain.
In pain. Yeah.
And our friends watch, so if you're watching this, like, this is nothing on you. This is all us. It's just our story. We love you guys, and we don't blame or think anything. Like, it's just, this is us.
There's a lot that we were going through at the time, and we're like,
And
we don't want to put it on other people.
yeah,
We
we
just
chose not
like,
to tell you, so it's not your fault if you're like, oh my gosh. No,
I did not. Yeah, it was.
we chose not to say anything, and that's on us. Anyway, so yeah, we went to Friendsgiving, and then we went in to get my blood work again. They got it, and like in the office, they looked at it and they're like, yeah, this isn't rising as
Not
fast
supposed
as
to.
it should. There's something wrong. Come back in a week and we'll get it checked again. I'm like,
We're not even going to be here in a week.
a
We're going to be back
week?
home.
A week? So then I think I was able to make an appointment in our OBGYN a week later. But I was already 7 weeks pregnant. 7 and something days, because, yeah, it was 7 and something days. We were getting close to reaching 8 weeks,
Yeah.
because it went all the way to 8 weeks and 5 days. That's how far the pregnancy went before I went in to get the surgery. And so I don't remember exactly. It was all a blur after that. I was just in so much pain and just bleeding and just kind of really angry that I wasn't being taken seriously again. And I was just, all I wanted was to save my tube. I just wanted to save my tube. And I think we were supposed to go November 30th to get checked in again. But on November 27th, I think it was,
I think so.
I was just dying, and I said, I can't do this anymore. So I called the nurse and I was like, hey, I really think something is wrong with me. Can you get me in sooner? I don't want to lose I'm like, we think it's ectopic. I don't want to lose my tube. And the nurse was like, what? Because they were like, I don't think we have any spot for you.
Mm-hmm.
Just wait out till it's just 2 more days. And I was like, do we think it's ectopic? And I'm bleeding a lot and I'm in a lot of pain. And she's like, what? There's nowhere here that says you think it's ectopic.
Which, once again, that the doctor that we went to should have said it. Like I said, if you're watching this, or if you know the person or anything like that, tell them to quit their job, because they should not be in that position.
So she's like, oh my gosh, let me see what I can do. They are able to get me in the next day, like really early in the morning. We go in, and they're treating me like, it's just a regular checkup, because they don't want to assume the worst.
Yeah.
But yeah, we go in, they're like, so you're 8 weeks pregnant, and I'm like, 8 weeks and 5 days pregnant, and I'm like, yeah, I guess, but like, it's not gonna.
Yeah.
It's not
It's
gonna
not going
end.
anywhere.
Like, yeah. And they're like, okay, we'll see. So they do another ultrasound, and the face that the OBGYN made when they looked.
Yeah, he comes in, he's like, you guys need to get to the ER right now.
He looked at my tube and he was like,
Yeah.
and then he left. So I was like, he comes back and he's like, you guys need to go to the ER right now. She needs to have surgery.
Yeah.
And I was like, Oh my gosh.
So they already called the doctor. He's waiting for you.
Just go in.
Just go in right now. Like, go there right now.
On the way, we call your parents, we let them know. They were already taking care of Neymar, so
Yeah.
I called my parents. They're like, we're on our way. And um at that point I was just like, please, just no matter what, just like save my tube. Like I just want my tube saved. That's all I wanted this entire time. My tube to not be taken away. And none of the doctors could give me a for sure answer until we went to the ER. And that surgeon was like, we need to remove your tube.
He said it how it was, but
Like,
he's also like, I don't know why this took so long. I don't know why this was pushed off so long. This needed to be treated weeks ago.
yeah.
He's like, but we're gonna have to take out the tube.
Yeah. And I was so pissed. Like, obviously, heartbroken too. I guess I haven't really touched that part. Like, the entire time I was heartbroken because I knew that this baby wasn't gonna, like, make it. But we also had, like, hope
Yeah.
throughout. It was like a roller coaster. Like, I don't know how to explain it, but it
It's like
was.
there was so much happening emotionally, right? In that time
And physically.
and physically for her. Like we chop it down into like an hour, right? But this is weeks. Weeks of frustration and heartache and like what is going on? Like just confusion, like all these different emotions and everything. Like it was weeks of it. Not just like, it was weeks. Of not knowing and wondering why they're not taking us seriously and why they're not getting us in, why they're not like what is going on.
Yeah. And I was also scared because the doctor was like, it's you're about to, like, your tube's about to rupture. He's like, I'm gonna see what I can do, but I think we're gonna have to remove it.
He's also like, I need to tell you this because it is a possibility you could lose a lot of blood. He's like, we do have blood ready for transfusion
Yeah.
in case, but there's always that chance, right? There's always a chance of something
Wrong.
going
happening.
wrong in surgery. Like they have to tell you that, right? Which gets us to after the surgery, but we'll get to that point.
Getting wheeled in and all that, I don't quite remember. I think my mind blocked it. I don't even remember them like putting me to sleep at all. Like there's like a section that is missing in my memory.
Because did they give you the sleep like the? I'm trying to remember what point I left.
Anesthesia?
Yeah,
I think you weren't. No, they wheeled me into the OR, and that's when they
yeah.
put me under.
They gave you something before that, right?
I don't know. I don't
They
remember.
gave you something and then they wheeled you off, but I couldn't go. Obviously, I couldn't go into the ER or the
OR.
The OR. Yeah.
Anyway, I don't quite remember. And either way, like as soon as they put anesthesia in my body, like I'm out. I can't even do the counting down. Like I'm out. And I just wanted to be out. Honestly, I just wanted to be out. I think that was the part that I was most grateful for. I got some time to sleep because I was in so much pain. I wasn't like I hadn't been sleeping well because I was just hurting and bleeding for weeks. Bleeding for weeks and in pain for weeks.
Yeah.
So this part,
Then it goes over to my side of the story.
they told you that it was going to take a certain amount of time?
Yeah, so they said it was going to take anywhere between 45 minutes to I think an hour, something like that. Anyway, so they wheeled Mara back. I had to go to the waiting area, which there's tons of people out there. And so I just found a table and I'm sitting there, I'm giving people updates and everything. And there was a piano playing. Anyway, there was just like a lot of people, right? So I'm sitting there watching, and a nurse would come out, and then they'd put it, I think they put it on the intercom or whatever, like, the Johnson family would come up, and then they would go into the, what is it, dispatch? No, not dispatch. What
I've
is it
never
called?
been in a waiting. I don't know.
The debrief or whatever, like the debriefing room. So they would take them to the debriefing room, like everybody in the group, and so like, okay, that's what's gonna happen. They're gonna come out, do the debriefing, whatever. So I'm sitting there waiting, watching everybody come and go, come and go. I'm trying to find, there's like a TV with names on the list, and I'm trying to find Mara's name, and I don't think it was up there, but sitting there waiting. 45 minutes passes by, nothing. An hour passes by, nothing. An hour and a half passes by, nothing. So at this point, I'm like, I think, was it an hour and 45 minutes or 2 hours?
I think it was 1 hour 45 minutes.
Yeah, so an hour and a half passes by and there's nothing. Like, there's no update, there's no nothing. And they're like, yeah, it's a quick procedure. It's going to be an hour, 45 minutes to an hour. So I'm sitting there like, it's been an hour and a half. It's half an hour past,
No updates.
No updates, no nothing. Like, I'm like, what is going on here? Anyway, an hour and 45 minutes passes. I'm still watching people, get taken back to the debriefing room or whatever. And I look up and the door's open and the doctor, the surgeon comes out, which I hadn't seen the surgeon, like any of the surgeons come out before. It was just the nurses getting the people, like the family members and stuff like that. The surgeon came out and he's not like walking fast to find me. Like, he looks around and sees me and like slowly walks over. And it was like, it wasn't very far away, but like that time felt forever, because like, what is going on? My heart sank, my stomach dropped. It was just like, why is a surgeon here? Like, what is going on? Like, holy crap. Like, obviously my mind's going like racing, right? I'm like, I'm gonna have to go home and tell Neymar that it's just us now. Like, what is going on? Like, everything went through my mind. I was like, it was just a span of maybe 30 seconds, but he was walking slow, and like the piano was sad music, and I was just like, what is going on? Like, everything was just like, it felt like my world shattered right there. I was like, what is happening? Anyway, he comes over and he's like, okay, the surgery was good. There was a hernia, and so we fixed that. I'm like,
That's why it took longer.
why? Anyway, like, I was happy, but at the same time, I'm like, why did you come out and tell me? Like, what's going on,
Why did you take forever to read?
Why'd you take forever? Why'd you? Anyway, so, all these things are going on in my head, and I'm like, it was like a relief. I'm like, holy crap. Like, for those few minutes, few seconds or whatever, she was, like, Mara was dead in my mind. Like, she was gone. Like, the surgeon was coming out to tell me that she was gone. Like,
It's not funny.
it's funny now, but at the time,
It's
it was like I don't get scared, but that was probably the scariest moment of my life. Like, I've watched scary movies, I've been jump scared, I've been to haunted houses, I've been to all the blah 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 blah. No, that was the scariest 45 seconds of my life, because I was like, she's gone. Like, what do I do now? Like, what do I tell Neymar? What do I tell your parents? Like,
that would be awful.
so all of that was going on in my head, and I was like, anyway. So he comes in, everything is good. Of course, I'm like super happy at this point. I'm like, she's alive. Like, in my mind, 2 minutes ago, she was dead. She was gone.
I wake up, right? I'm by myself still. They wake me up. And the first question I ask is, did you guys remove my tube? And they say, yeah, we did. And so I'm like pissed off, like so mad that it got to the point where my tube needed to be removed when we probably could have saved it had they listened to me the very first time that I said something. Probably.
Yeah.
Who knows? Maybe at that point it was already too far
Who
gone too.
knows?
But how am I supposed to know? We waited 2 weeks after that.
Yeah. So I walk into the recovery room, and Mara's about to throw something at me as I walk. Like she was.
Not at you.
I know, but she's mad. Like she's way mad.
Not just mad, also, well, not just mad about the tube, but like upset that this happened. That
Yeah. So like upset, mad. You were just like not in a good spot. But then I'm coming in like a freaking puppy wagging its tail. Like you're alive. You're alive. Like I'm giddy. I'm like.
I'm also very nauseous.
Yeah, that's the other thing. So I'm like super excited because she's not dead. She's living, right? And she's mad and she's
Heartbroken.
And,
Nauseous.
yeah. So yeah, she's just upset. And I'm trying to have empathy, but there's none. There's no empathy. I'm like, I don't really care about that stupid tube. You're alive. Like you are alive. Screw that tube. Like I thought you were dead. You know, when I was out there, like, I don't really care about the tube. I didn't say that, right? In my mind, I was saying it. But, like, it was so hard to have any empathy right then. Because,
I was alive and not dead.
yeah, like, I could care less that they took the tube at that point. Like, it did not matter at all to me that the tube was gone. Mara didn't have to live that part of her being dead,
No,
right?
I was asleep.
And so she didn't understand.
No, and I didn't know. He didn't quite tell me then. I think you told me.
Because I was trying to like be there for you, you know. I was trying
He
to.
told me a little bit after, like, this is what happened while you were gone, and so this is why I felt this way when you came out of your loopiness.
Yeah. So it
And
was
so,
like,
I totally understand that. I probably would have been the same. Like, it really does. That's you still
that
have another
stupid
tube.
tube is the least of our problems, right? Like,
It wasn't just the tube though. Like,
I
it
know.
was the pregnancy. It was our baby. It was like
and I 100% get all that, but like in the moment, none of that mattered at all.
another thing. Why it made it so hard for me was I got pregnant at the same time as one of my cousins, and I lost the pregnant. We were like a week apart, I think, about a week apart, and she stayed pregnant, and it was like the due dates were so close. So that pregnancy that she had and like her baby was just like a reminder of what we didn't get to have.
Yeah.
And it's nothing on her or, like I don't have any like
Resentment or anything.
no, there's no jealousy, there's nothing like that. It's just
It's the happy for someone, but
heartbroken
for yourself. Yeah.
It was just that reminder of they were able to live out the dream that we wanted to live. And it was very sad because it was somebody close. Like, if it had been somebody else that wasn't as close, it wouldn't really, like, I don't think it would have affected me as much because I wouldn't, like, see that baby as much as I would see a stranger's or, like, a friend's or whatever. And we just barely met this baby, like, not that long ago. But looking at him, I was like, we could have had, but then we wouldn't have Evelyn. So
Yeah.
obviously, like, things happen for a reason. And I, now that I'm on the other side, like, I am grateful for everything that we've gone through and lived through and what we have now. But in that moment, when I still wasn't on the other side, it was so hard to live
it's a
through.
whole different world.
Mm-hmm.
And even after that point, it was hard for me to have empathy. From being like, I was, I was there for her, obviously, but still, like every time that she started complaining about it or being upset about it, like for me, I was just like, why does it matter? Like you're lying.
What matters is that we don't get listened to. Like, they don't listen to us when we tell them, we know our bodies more than you do. You're a stranger. You've never.
Which I will say, all the ones that didn't listen were all the young doctors. It was the older doctors that did listen. So if you're a young doctor, listen to your patients. Like they probably know their body better than you do. Yes, you went to school, but that doesn't really mean anything. Like if there's something wrong with someone's body, especially if they've gone through it multiple times, they probably know better than you. Like most likely. I know there's things set up, that make it harder or whatever, but
Just take it more seriously. I don't know. It just.
it's hard to pinpoint, but like go hang out with old doctors. Go hang out with people that have been in the game for long time. And obviously this isn't all young doctors, but if you are a doctor and you listen to it or you're going into that field, take that advice. Is go hang out with these old doctors. They know what they're talking about. Like it was a whole different world back then with medicine. And it's too easy to get lost in the procedures and lost in the, oh, I got to check this box and this box and this box and this box and this box before I can actually do anything. Anyway.
I'm still upset at the fact that. Not necessarily that I lost my tube. Like, yes, I'm sad that I'm missing that, but it was just that for this entire journey, I felt like we haven't been heard. Like, we weren't heard. How long can we talk more, or should we end it here?
It's 47 minutes.
Okay, we can end it here. So this is just the ectopic pregnancy, and next time we can talk about all the procedures.
Yeah.
Actually, we have another chemical pregnancy.
Yeah.
And
before the actual. But that's why Mara wanted to start this podcast so bad, is because, one, we didn't get heard. So we know, Mara was pushing it too with these doctors, and they still didn't give us the time of day, right? So there's definitely women out there that are being pushed around.
Advocate for yourself.
Yeah.
Seriously.
If you think that you have something going on, don't stop pushing. You do know better than the doctors most of the time, right? Obviously,
and even if you don't, still advocate for yourself.
Yeah. Keep pushing. If you feel like there's something off, your body knows, right? There's most likely something off. Anyway, so, but also you're not alone. That's why we're also doing this, because it's not talked about a ton.
And for me, looking up ectopic pregnancy stories, if you have these symptoms, get checked out.
And keep pushing. Keep pushing.
Tell them that you are going through the same things that every other, because all these stories that I heard,
similar,
that I heard about ectopic pregnancies ended up the same way. They were not taken seriously until they needed to get their tube removed. Not all of them. Some actually were heard and they took the medicine and they terminated the pregnancy before their tube needed to be removed. But most of them we waited for too long, or it was an emergency. My tube ruptured. It was that.
Yeah.
It's the same story. Anyway, it's kind of sad ending. But
But you're
also
alive,
not.
so
I am alive. And there's a reason why there's two things in your body for not everything, because we only have one liver, but
2 kidneys, 2 fallopian tubes,
two
2
ovaries.
ovaries.
We only have one uterus, but like there's a lot of backups for things. There's a reason, I think.
Yeah, I think so too.
Anyway, thanks for watching or listening. Hopefully this can help you out if you're going through something.
Or you know someone that
Is going through
is
something
going
like
through
this.
something, you can be there for them and kind of understand a little bit better.
Mm-hmm.
Anyway, we love you guys.
Mm-hmm. You are worth it.
You're worth it.